Nice. All right. Um, so yes, my name is Tammy, and I'm a member of Put People First PA, and I joined in 2017. Um, so Put People First PA is a statewide grassroots staff-free um, s- um, organization that actually helped launch the Nonviolent Medicaid Army nationally in 2020. So it's made up of multiple organizations, even some organizing around different fronts of struggle, including the National Union of the Homeless. And these are folks, again, like staff free. So we fight for these things because we believe in them. So I'm going to talk a little bit about, okay, so the objective. So one thing is I wanted to share the negative impact from when the adult dental benefit was cut in 2011, because we used to have a little bit more dental care in Medicaid in Pennsylvania, until the governor of that time actually cut it. I think it came out of the ACA like process with that. Objective two, share how we've been organizing to get the adult dental benefit restored. It's been several years as a part of our Healthcare as a Human Right campaign. So it's not the only focus around healthcare that we actually take on. So when thinking about some of the impacts that happened, like what was cut from this dental care, so you can no longer get root canals or crowns with Medicaid. Periodontics, I think it says here, like services for treating gum disease, such as scaling, root planning, were eliminated. The dentures, so it went from you could get a new set every 7 years to now one in a lifetime. And most importantly, was that millions of unnecessarily pulled teeth happened. I am one of those folks, as somebody who suffered from not having dental insurance, right? Because that's how we structure our healthcare for many, many years, where I couldn't get the regular teeth cleanings. And because of that, that led to plaque underneath my gums, that led to now advanced periodontal disease. And I required a deep cleaning that the community fundraised for me in order to do that. But again, even I myself, according to dentists, should get teeth cleanings every 3 months if I want to continue to not lose teeth. Unfortunately, Medicaid only covers for every 6 months. And I understand that they say you could file, I forget what they're called off the top of my head, but I can tell you that it is very limited on how those even get approved. So they're pretty much non existent. Um, One of the ways that go from one, showing impact, but also how we organize and advocate around this is in 2023, when they started taking back like some of the pandemic protections. Um, what happened was about 20 million people got cut off of Medicaid. Most people actually still qualified, they just didn't know that. So we started, as a part of that organizing drive, Medicaid Mondays. Most of these, what I did is I went through and pulled ones around dental stories, and they're from all over the state, but we do actually share on social media more than just dental stories. You know, it's around healthcare in general. So we call this political storytelling. And as you can see, as we go through the various slides, that these are folks of all different demographics from all different regions of the state. Another way that we organize around this is that we do door knocking. So we go into communities, especially ones with higher poverty rates, and we do door knocking and we talk to those directly impacted and share about our fight around restoring the adult dental benefit, and connect with folks to either share their story or to get involved in the organizing work. We do people's clinics where we help people sign up for state benefits like Medicaid. We actually also help them file appeals if they get denied, and actually help them through that entire process. And because of that, Put People First has about a 98% success rate versus the 0.01% if someone goes and tries to advocate for themselves through the process of the state. Some other things that we do is we look at like different activities that offer like care to try to help meet these gaps. So thinking about, I don't know if folks are aware of the Mission of Mercy dental clinics. So we organize to put out the advertisements about them, and also connect with people to offer rides to these services. Honestly, like currently right now, I don't have a dentist, so this is the only way I get care. So I get care once a year now. We also participate in various community events to spread the word about our campaign and offer folks to get involved in our organizing efforts. We do engage and work with the legislators. So another way that folks can do is not only just share their story as a social media story share campaign, but also to write to share their story with their legislators. Because one thing that we have found is that many of them seem to say that they don't know these things. They don't know folks are struggling like this. And so this is one way to share that. So storytelling is absolutely very important. Um, One thing that I wanted to speak a little bit more on is in early 2024, we delivered, as folks know, there's been bills in the House, right? Like this has been a part of our process for years that we got to this point. Um, and there was a bill that had passed the House but stayed stuck in the Senate. And we delivered a petition with more than 1,000 individual signatures to Governor Josh Shapiro and DHS Secretary Valor Cush, which I can say as a part of that event, there was a few folks that actually met with her office as we were taking action outside. And one thing that we were asking for is for her to actually include in her budget that she presents to the governor the money that would then support reinstating the adult dental benefit, which she had agreed to, but then didn't do it. Um, and then also that petition also included about 23 different organizations that signed on in support. They varied from different advocacy organizations, organizing around different fronts of struggle, or even some in academia. I think one of them was, I mean, I don't know if it was really classified academia, but from the Social Services Educational Department of Millersville, for example, right? That department signed on in support of this. And so as a part of that, as you can see, we did that rally and we delivered that petition. And then what I kind of want to get into a little bit here, and I think I went pretty fast. I'm not sure where I'm exactly at on time, but this is my last slide. And the part that I really want to highlight the most. So a call to action. First of all, you could follow us on social media. We're on Facebook, Instagram, whether it be Put People First PA, which is focused around this state specifically. But then there's also the National Nonviolent Medicaid Army. We also have, which I didn't add on this slide, is we also did create a Facebook group. I think it's got 400 and some folks that joined it. We don't really advertise it all like that, but it's called Restore the Adult Dental Benefit Medicaid Now. And interestingly enough, and this is why I was so excited to hear how many states are at least kind of thinking about doing this, was folks were coming across this Facebook group and then started reaching out to us about reinstating the adult dental benefit in their said state, which was kind of interesting. So you could also, thinking about many of you are providers. So even as a provider, what could be your Medicaid story as someone like what would be benefit for you? Would reinstating the adult dental benefit help your practice, help your clients? Think about how many folks don't get the care they need or get very little care because of that benefit is not in place. I know, for example, my husband, a dentist just couldn't believe that he didn't want to get a root canal. It wasn't that he didn't want to get the root canal, it's that the root canal costs $2,000 and we don't have $2,000. So just, there's examples there. So you as a provider could share your Medicaid Monday story, but you could also share the link to offer it to the folks you care for. We could also make sure that you have flyers available or our trifolds that we have. I think about someone like myself who there's no way I would have been able to even stand in a room like this, giving a presentation like this, and being able to sit on a panel and answer questions if it was for not the leadership development that I received from this very organization. I was somebody who dropped out of high school because of poverty, tried to go again, still had to drop out because I had to pay rent. And so a lot of opportunities were missed to me and still are to this day. And so this organization and this ever-growing movement that we're building has given me the opportunities that this system and society has denied to me, including my love for writing, because I've been able to publish some things thanks to this network, something again that was denied to me. And I think about the many people that you guys serve and the opportunity that being a part of an organization like this could benefit them. And above all, you could sign up to be on our email list where you can learn about the work that we're doing across the state. Yeah, that's what I got.